Hi, everyone. I'm Stephanie with Nine Health. It's the last week of Mental Health Awareness Month, and all month we've worked with the Colorado Department of Human Services, their Office of Behavioral Health, to talk about several different mental health topics and connect you to experts. I have several joining me today, and I'll introduce them all here in a moment. And then we'll kind of get into some questions that I have. You can ask the questions that you have. First, before we start, support for some of our mental health programs is provided by Regis University. We ask how you ought to live. Learn more about Regis University's counseling and family therapy program at regis.edu. So you can learn more about that, all that there. Now I want to introduce my guests. We're talking about veterans' mental health today, which is timely with Memorial Day being yesterday. Let's introduce all of our experts. I have Corporal Tage Harding, he's a Marine. Yolanda Webb, she's Director of Adult and Aging and Disability Services with the Department of Human Services. Sherry Skelding, she's Vice President of Clinical Operations for Rocky Mountain Crisis Partners. And of course, Nine Health expert Dr. Pal Coley is joining us as well. She's a cardiologist, also an expert on internal medicine, preventive medicine. First, Dr. Coley, can you give us an update on COVID-19 today? I know we just had an announcement from the state.
So here in the state, actually, Governor Polis announced that starting tomorrow, many restaurants will be open for dining in service. So that's certainly a positive sign. In terms of the markers of the disease activity, looking at testing, our goal for the end of May was 8,500 tests a day. Unfortunately, we're still quite a bit short of that goal with less than, half of that goal. The average for the last 2 weeks was 3,985, so just below 4,000. So we still need to keep working on increasing that testing, especially as we're opening up, because we need to make sure that we're doing it in a safe fashion. The good news this week is that no hospitals are anticipating PPE shortages or shortages of staff, and the hospitalization numbers have actually been about as low as they've gotten since March. Now, there is a caveat to that, which is that only 68% of hospitals reported over the weekend because of the holiday weekend, as opposed to 93% reporting information from last week. So it's possible that all the data has not come in yet, but these signs so far at least are looking encouraging in terms of the resource availability. Nationally, of course, we are expected to cross 100,000 deaths this week, which is a very sobering milestone. And we're seeing some states that are opening up actually starting to have second peaks occurring, such as in Alabama. So as we open, we'll have to just keep a close eye on all these parameters and kind of see, how the disease activity progresses.
The stay-at-home orders, COVID-19, the uncertainty has really taken a toll on everyone's mental health. So we really wanted to make sure we covered several mental health topics this month for Mental Health Awareness Month. Again, it's the final week. We're talking about veterans and their mental health today. Again, I'm joined by Corporal Tage Harding with the Marines, Yolanda Webb, Director for the Office of Adult Aging and Disability Services, the Department of Human Services, Sherry Skelding, Vice President of Clinical Operations for Rocky Mountain Crisis Partners, and you just heard from Nine Health expert Dr. Pal Coley. You can ask us your questions about any mental health topic, any health topic that you want to ask a question about in the comments, and we'll get those answered. First, Sherry, I'm going to ask you, we'll start with you. Why is there an urgent need for mental health services for veterans?
Sure, thanks, Stephanie. Well, I think we've known for some time that our veteran population certainly has some unique and specific needs when it comes to mental health. But I think the urgency right now is really coming around some of the governor's challenges that have been issued in addressing service member and veterans' mental health, and specifically around the topic of suicide with veterans. We have been really as a nation, we've been really aware about the risk factors for veterans when it comes to suicide, and the challenges of accessing that community, which I think Tage will talk a little bit about, but just some of the stigma and the difficulty that folks in that community have in reaching out. So our goal with the program that we're going to be talking about today is to really figure out some ways to reach out further into our community and get our arms wrapped around some vets that could really benefit from some suicide prevention initiatives.
Yeah, and there is a new program, which I put in our teas for all of this, a new program in the state to support veterans. So like Sherry mentioned, we'll talk about that in just a moment. Tage, I wanted to have you add to what she just said. Again, Corporal Tage Harding with the Marines, talk about the urgent need for mental health care with veterans.
Yeah, I think veterans sort of feel a type of isolation as soon as they separate from the military. Can you hear me? Can everyone hear me?
Yes.
Okay. Sorry.
Your video is skipping a little bit, but we can hear you.
So suicide is a huge deal. There's an average of 22 military members that commit suicide a day. And that's more suicide deaths than both in Iraq and in Afghanistan. So I think that military members become even isolated with survivor's guilt, even though it wasn't straight from combat. So I think that mental health is extremely important, and definitely need some help. And the vast amount of military members that have PTSD and depression. So.
And you're cutting out a little bit, but you offer an important perspective. So I want you to try to stay with us because we are getting some of what you're saying. And maybe it's just my connection too, but some of it was cutting in and out. Let's just keep going on. Again, you can ask your questions as well on Facebook. Sherry, we want to talk about this new program with the state, the Veterans Hospital Follow-Up Program. How did it come together, and just explain what that is?
Sure. So when we talk about hospital follow-up, what we are referring to through Colorado Crisis Services is an initiative to identify individuals that are in our hospitals and in our emergency departments throughout Colorado. This is an evidence-based practice that we've actually been practicing in some form or another at our agency for a few years. And really what it's about is when we know that when individuals are going to an emergency room because they've had some kind of a behavioral health crisis, and specifically a suicidal crisis, meaning they're there, they're mentioning suicide in some way, they're at risk for suicide, and basically there's some suicidal ideation. Contrary to what maybe many people might think, is that actually going to the hospital when you're experiencing that kind of a crisis actually increases your risk for dying by suicide when you come home. So those periods of transition from care to home, or even if you're in an emergency room, you get some resources, have an assessment, and you're not hospitalized but sent home, the risk at that point actually escalates quite a bit for individuals. So the goal of this program is to partner with hospitals throughout Colorado, that when individuals are identified in an emergency department, that they can actually be referred over to our follow-up program. It's a relatively simple intervention as far as the big scheme of behavioral health interventions go. And what research has really talked about is it's the ongoing support and messages of care and concern that have a real preventative measure for folks that are kind of in these situations. So our goal is to identify individuals as well that are veterans or are service members and involved in that community, family members as well. This new program through the state then is going to allow us to build more of a veteran peer intervention within the crisis line and within our call center, so that we can really provide some vet peer-to-peer support during these times. Really help connect, have an experience where folks can talk to others that have maybe served or are very familiar with that community. We hear a lot from our vet population that it's really hard to reach out, but having someone who kind of gets me or who has been in those kinds of situations is really our goal, to increase the likelihood that we can help connect people to resources and keep them safe and connected during these periods that we know are high risk for suicide. Yeah. Oh, you're on mute, Stephanie.
Let me unmute myself.
There you go.
And we lost Paige, but hopefully we can get him back on here as well.
Yep.
Yolanda, can you address some of the barriers to access for care for veterans, especially mental health care access?
Sure. You know, we realize that many of our veterans are homeless. So being able to really find and offer the treatment that many of the veterans need in terms of mental health care services is an issue for us. Things like veterans don't necessarily want to come into settings. And so establishing in-home care programs for veterans, we find that transportation is often a barrier for many of our veterans. Quality access to other primary care wraparound services can be a barrier for our veterans. We right now are going to be running within the next fiscal year a needs assessment, a statewide needs assessment, because we really want to know what those veterans' needs are so that we can adapt our programs to meet those needs. We also want to take a look at where are the veterans that we need to reach. Some are in some very rural areas of Colorado, and so that can also be a barrier because we don't necessarily have services in those areas.
Yeah, we talked about rural mental health care last week. So yeah, a veteran on top of being in a rural area, there's just a lot of barriers to access to care there. Dr. Coley, I wanted to bring you into it as well. You know, Sherry's talked about some of the preventive measures with dealing with mental health, especially with veterans. Is there just anything you can add as far as, you know, taking care of, anyone taking care of their mental health right now, but especially someone maybe in a rural community or a veteran?
I would add that the veterans are certainly considered one of the high-risk groups, not just for mental health problems with the pandemic, but also for, infection with the pandemic itself. And there are certain risk factors that I think Tage mentioned, but they're worth repeating. The first is a high incidence of mental health problems coming into the pandemic, such as loneliness and isolation, substance abuse, depression, anxiety, and PTSD. These are all factors that have been identified by the CDC as marking people who may be higher risk to then go on and develop mental health problems from the pandemic. And then in terms of physical health, we know that the rate of things like alcohol use and smoking is high amongst veterans, which can certainly also increase the risk of complications from contracting the COVID virus. And then, as Yolanda mentioned, there's a lot of socioeconomic barriers and also a lot of lifestyle things that can influence their ability to socially distance or to access timely medical care. So all of this put together, I think, really does make this a very high-risk group. And it's really especially important, number one, to educate, I think, that this is a high-risk group. So that if you know a veteran or have a veteran in your community, just keep a close eye on them, because early recognition, I think, is very important to getting treatment. And then second is to really try to help them connect to the resources. 9healthfair.org does have several free resources that are available, including depression and anxiety screenings. And they can also help connect you through telemedicine with free resources as well. The Colorado Crisis Hotline, as Sherry's going to talk about, probably has that as well. So I think recognition is the most important thing in prevention, and the second most important is to get them connected to the right resources.
Mm-hmm. Yeah, and if I can
Right,
add on
and
that
again,
too.
9healthcare. Oh, go ahead, Sherry. You can add to that.
No, yeah, I was just going to say a little bit more about our program, and the goal of kind of connecting with vets is, like, I think we've all talked about the isolation, and that's already been a characteristic of this population for some time. And part of the goal of having vets serving on our line is to offer kind of a lifeline for that same issue, and to get people connected to someone that they feel comfortable talking with, right? We know that one of the major barriers to behavioral health care is just feeling comfortable and reaching out and saying that you need help. And so, one of the benefits of the crisis line is that the barriers are pretty low, right? It's pretty much anyone can access for whatever reason. You do have to have access to a phone. But short of that, our goal is when we have people calling in, or through this program of identifying our vets that are showing up in our emergency departments, that we can sort of wrap our arms around them and get them connected to services that feel lower barrier for them. We know that a lot of the vets throughout Colorado aren't necessarily engaging in the VA or showing up in those areas when it comes to suicidal crises. They are showing up in our community hospitals, in our emergency departments, and they don't always get connected in the ways that they need to back to the resources that really could provide some of the most targeted interventions, and sort of putting them in a community that they can identify with to feel like they can do some healing. So we've been really partnering with the VA and the suicide prevention coordinators that are at the VA as well, so that when we can start identifying those folks, we can work behind the scenes to really try to get everybody connected in those ways that works for the veteran themselves who may need help, but also kind of plug them into the system of all the things that are going on behind the scenes that might not always be obvious for folks that are living rural, or even folks that are sitting in the middle of an urban area, but just don't yet have that knowledge because it's been so hard to reach out.
Yeah, Yolanda, I don't know if you can add anything else to that, just how the state's tackling barriers to access to care.
Sure. As I mentioned earlier, we will be conducting a statewide needs assessment. But one of the things that we have found, and I think, Sherry, you may have mentioned this, is that peer-to-peer relationship. What we know that is really important for our veterans, especially our senior veterans, is this ability to talk with someone who has a shared experience. And so we're looking at that in our congregate living settings, because the barriers that we have is they don't necessarily access telehealth very well, but they will talk to another soldier. They will talk to another military veteran. And so that's one of those barriers that we're looking at breaking down. We just recently had General Lowe video a message to our veterans in our congregate care settings. It was really well received, and we are awfully grateful to him for sending a message encouraging our veterans to socially distance, to access mental health and telehealth services. And so those are some of the things that we're doing, but we're really hoping that our needs assessment will shine some light on what barriers we need to begin to tackle. I think you're on.
I'm trying to unmute and get off the gallery view at the same time. We have Tej, he's joined us once again. I'm sorry we're having some connection issues with you. I wanted to ask you, we talked a little bit about this, but maybe you can give some perspective on how COVID has affected these veteran communities and some of the mental health impacts of that.
Definitely. I think that military members that have already separated feel isolation already when they don't have contact with some of the really close friendships that we made in the military. And with COVID, that isolation has just grown exponentially, you know, especially with veterans losing jobs, veterans that can't get healthcare treatment, veterans that can't go and do the things that are in their daily lives. I feel like military members are very schedule-based and structure-based. So COVID-19 definitely throws a wrench in a feeling of consistency with military members. And then on top of that, military members asking for help. And COVID-19 makes it that much harder to find help for whatever veterans might need.
Yeah, I think that's a challenge, you know, for everyone right now, is finding the help that we need, and having structure and schedule is really helpful for really anyone right now. I don't know if anyone else wants to add how, you know, the COVID pandemic has affected our mental health, especially maybe veteran communities.
Yeah, I think a lot of what Tej just talked about is pretty well representative of what we hear on the crisis line as well. We, you know, initially when we started talking pandemic sort of worldwide and the safe at home orders started, we definitely saw an increase in volume on our crisis line and on our peer support line. Things have leveled off a bit, but I would say that the vast majority of calls we get in some way, shape, or form, we're talking about COVID, whether it's about how to parent through this, whether it's about the job loss, the isolation, and I think more recently just about, so what are the right decisions that we make right now, right? There seems to be like no good options that are the perfect, safe, magic wand options. And all of our callers, I think, are really experiencing that stress, but it's also starting to come out more with like, well, but my neighbors are doing this, but I don't agree with that. Or the guys down the street are doing this, but that doesn't make me feel comfortable. And then we see this playing out in front of us on TV, you know, certainly a political situation. So I think that stress overall is very high. And when we take sort of communities that are already at high risk, as some of the things that we've talked about, for being, you know, exposed to trauma and pieces like that, and then we add this layer on top of it, it certainly becomes much more challenging for all of us. And I think that what we really want to get across, and I think we've all heard, I hope it hasn't become too cliche, but right, we're all in this together type thing, meaning that there's not one of us that isn't affected by COVID-19, but we are all affected in our own unique individual ways. And I think that we need to sort of embrace that and understand that while we have a common experience we're living through, our individual experiences are really unique. And I think that that's the goal of some of the programming around the vet specific peer-to-peer interactions, is that we can really hone in on what are the differences and what are the unique factors that we can really help build some connection and kind of crack away at that isolation a bit, because connection is what keeps us safe and connection is what keeps us healthy. And we're all struggling to do that really effectively right now.
Stephanie, I would add to that, particularly for veterans that are living in congregate living centers, our veterans community living centers, one of the things that we saw was an increase in behaviors because many of those veterans suffer from dementia or Alzheimer's and really didn't understand the sort of stay at home, safer at home initiatives, restrictions on their ability to move about in their own home. And so we saw quite an increase in behaviors, but simultaneously what we saw was veterans losing skill levels, adaptive skill levels, because they didn't have that opportunity to move about because they were isolated in their rooms. And so there were some things that we recognized early on and we tried to mitigate along with trying to keep people safe.
And Stephanie, I would just add one more thing, which is that, you know, there are a lot of parallels that have been drawn between the pandemic and war. And so in some ways, the veterans are actually poised to teach the rest of us how to cope with the stresses of the pandemic, because they've actually been on the front lines of dealing with a war. This is a war that we're fighting. It's just a different type of an enemy. So I think that I personally found that that's been an encouraging way to empower the veterans to sort of really think about crisis mode and problem solving and all the skills that they've been taught during their training and have implemented during their time in service, to really apply those to really this current crisis that we're all in.
Yeah, and I was going to ask you, Sherry brought this up, but Tej, I can let you add to it as well. I was just going to ask Dr. Coley, you know, and we can let Tej speak first, but just to also address what is the right thing for us to be doing right now, because I think that is some of the stress that all of us are feeling. But Tej, go ahead and add to the conversation on the veterans and dealing with COVID-19.
I absolutely agree with Dr. Coley. I think that veterans do well in a stress, and almost when you don't feel that stress every day, you start to go internal and think about kind of the difficulties that are in your own life instead of dealing with the stresses of helping others or something like that. But on top of that, with the isolation, I think substance abuse has become a huge issue as well, with veterans that have lost their job and veterans that are home alone. And there's nothing else to do than to look into some of these substances such as alcohol or drugs, and I think that's pretty dangerous with the severe isolation that COVID-19 has had. So.
Yeah, and Dr. Coley, maybe you can just talk about substance use right now as well, and what we've seen and talked about, and then just what Sherry was saying as far as what is the right way to act right now, because some restrictions have been lifted. You know, we were at the park yesterday trying to distance ourselves, but a lot of people were, you know, playing soccer, like 20, 30 people. I don't think they're all in the same household. So, you know, it's kind of people need people, humans need humans, but what is the right way to act right now?
So, you know, we have seen from data that the substance that's most commonly being abused right now is alcohol. And that's based on the liquor store sales really having dramatically increased. But it also applies to other substances like marijuana and cigarettes and other such things. So substance abuse definitely is a problem, not just amongst the veterans, but I think even amongst everyone else. And a lot of the circumstances have created mechanisms for people to be home more often, not be driving as much, and be using these substances. And we have talked in the past about recognizing how and when it becomes a problem. And that's really if you're needing to use it every day, if it's interfering with your daily functioning or your productivity, or other people have commented on it becoming a problem. So just keep an eye out for those types of things and keep that substance use in check, because the more you use substances, the more they can affect your immune response, actually, and that can affect your susceptibility to the virus. So it's not just the mental effects of substances, but the physical effects as well. And in terms of what we can be doing, it's a really tough situation because we're really in this transitionary mode. And as you all have pointed out, some people are on one end of the spectrum and some are on the others. But really, I want to drive home the point that we are not out of the woods. This virus is not gone. Pretending or thinking that it's gone is not going to make it go away. In fact, it'll make it stay longer. And just this morning, WHO, Dr. Tim Ryan issued a warning about something called a second peak. And there's a second wave and there's a second peak. So a wave means that the virus goes down all the way, and then several weeks or months go by, and then it can come up again. That happened with the Spanish flu. It actually happened with the SARS-CoV-1 virus, which was the original SARS virus in 2003. That's kind of out of our control. It depends on things like weather, temperature, those types of things. But a second peak, which is what we're really worried about now, actually occurs during the first wave, which is that the cases haven't come all the way down. And the only thing that's keeping the virus in check right now, remember, is that we've separated the people. So as soon as you bring the people back together, it's going to start to spread. And we're going to be back in that situation we were in before. We've all seen pictures from this weekend about parties and activities. And, you know, it's one thing to get together because it's your livelihood and you have to go to work and you work at a grocery store or post office. But it's another thing to be doing it in a social setting because the price we're going to pay for it is human lives. So it's challenging when other people are not complying, but we are in control of our own behavior. And I think I really want to reiterate, the more we socially distance, wear those masks, practice that hygiene, the more likely we're going to get out of this faster.
Yeah, thank you for adding in all that and explaining all that. I know you have to go, I think, around now, so we'll let you go. But I also wanted to just, sorry, my 4-year-old's in my office right now too. And so we're trying to, this is the world we're in right now. So I think Tej just left us. I'm going to ask him a couple questions too. But Yolanda, maybe you could just talk about the additional services available to veterans.
Sure. I want to encourage veterans, even if they don't typically access the VA. The VA is a wealth of information. We are on the same campus with the VA. They can at least give veterans access information to those additional services out there. CDHS itself, we have a number of organizations that we have partnered with to include our Veterans Commission, who can provide additional information. For senior veterans, I would encourage them to tap into their county AAA. And if they don't have a AAA, just call their county Department of Human Services and they can tap into additional services through County Department of Human Services. Also, there's a United Veterans Coalition that's out there that provides additional access to services and information that veterans can tap into. I just would encourage veterans to reach out to either the Division of Veterans Community Living Centers, our office at CDHS, so that we can really pair them with additional services out in the community.
Yeah, and I'll post all these resources in the comments as well. Tej, we're almost done here. I just wanted to kind of end with this, but Tej, how can civilians support veterans during this time?
I think civilians usually do a pretty good job of supporting veterans. You know, I think that everyone just needs to continue to help veterans in need. Reach out to veterans in your own life, make sure that they're doing okay and they're not feeling the isolation. With veterans, I feel like you need to build a sense of togetherness so that we can feel the type of brotherhood, sisterhood that you felt in the military. Veterans and the military alike just have a really big sense of togetherness, and yeah, we just need to foster that. So
yep, like we said earlier, it's kind of cliche now, but we're all in this together, so we all need to help each other, veteran or not. We all just need to look after each other right now. And there are screening tools. Dr. Coley mentioned these at 9healthfair.org. Click on e-tools. We have screenings, free screenings that are anonymous for depression, anxiety. They're easy to take a couple of minutes. It's even just a good, if you had struggled with mental health in the past, it's a good way to get a baseline on where you're at. So you can find those on our website. Also, I need to say one more time that support for some of our mental health programs has come from Regis. They have a counseling and family therapy program. You belong at Regis and their counseling and family therapy program. You can be one of these experts that we talked to. Go to regis.edu to learn more about that. And before we go, a reminder as well, if you have a health question or a coronavirus question, mental health question, anything, call our 9Health Neighbors line, 303-698-4455, extension 2005. Leave a message and a 9Health medical volunteer will get back to you within 24 hours. I want to thank all of our experts for joining us. If you have additional questions, you can post those in the comments. Someone did just ask, mental health has been a problem for a long time. Why are we just not worrying about it? Again, it's just Mental Health Awareness Month, so we are highlighting several topics. And during this COVID-19 pandemic, you know, we are all kind of struggling with different mental health aspects of mental health, not having a schedule, anxiety, uncertainty. It's bringing up a lot of issues, I think, for people that maybe even haven't struggled before. So good things to talk about. And I want to thank you all for joining me once again.